Good morning, and thank you for joining our weekly COVID-19 briefing. As always, we're joined by Health Commissioner Dr. Cheryl Bedegal. Today's briefing is being live streamed on the Health Department's YouTube channel and will be available for future viewings there. Today's briefing will run until 10:30. As usual, we will present remarks first in English, then in Spanish, then open it up to questions from the press. We ask that media outlets coordinate internally to ensure that only one representative asks questions and that we limit questions to 2 or fewer. If we have an opportunity for a second round of questions, we can do that. Please keep your questions focused on the topic of the COVID pandemic and the city's response. With that out of the way, Dr. Bedegal, would you please start us off?
Sure. Good morning and welcome to our weekly briefing. I should say our bi-weekly briefing. In the past 2 weeks, Philadelphia and the surrounding counties have seen a sharp uptick in cases of COVID-19. With cooler weather upon us and Thanksgiving in less than 2 weeks, this is very concerning. The highest number of cases are among 10 to 19-year-olds, many of whom remain unvaccinated. This is worrisome for teens, but it's especially worrisome for the older adults who may be about to gather with family for Thanksgiving. So here are the numbers. In the past 2 weeks, 2,351 Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 232 new cases per day, and the percentage of tests that are coming back positive has risen slightly to 3%. And this increase in cases coming at the beginning of cold weather right before Thanksgiving could mean that we're on the verge of another wave. It follows a decrease in mask use in the city that combines with the cooler weather to put unvaccinated people at real risk. So please, I know everyone wants to talk about when we're going to get rid of masks, but this is not the time. We have made real progress on vaccinations. Currently, more than 91.2% of adults, 84.5% of those 12 and up, and 4.8% of children 5 to 11 in Philadelphia have had at least one dose of vaccine. 74% of adults and 68.5% of those 12 and up are fully vaccinated. And more than 106,000 Philadelphians have had a booster dose so far. Today, we'll be publishing a new tab on our vaccine dashboard with information on children ages 5 to 11 who have been vaccinated. It's still very early in this new effort, so small changes will have an outsized effect. But already nearly 6,400 Philadelphia children have started their vaccine series. Most of these children are getting their vaccines at pharmacies, and we continue to work to set up new clinics with partners. That's encouraging because of the danger that I've already mentioned, that as we look forward toward Thanksgiving, particularly given the increase in cases recently, we may be entering another surge. But we have control of what happens next. Of course, you know I'm going to tell everyone who is not yet vaccinated that that is their best protection. There are some specific groups who I want to talk about in a minute who should consider a booster if they haven't yet had one. But for all those of you who haven't yet been vaccinated, you need special protection. Double mask if you're going to indoor public spaces. If you decide to get together with friends, keep those gatherings small. Meet outside when you can. And remind everyone that if they or someone they're in contact with isn't feeling well, even with mild symptoms, they should stay home. Plan ahead to use rapid tests the day of any gathering, including Thanksgiving. And yes, think about whether you are ready to get vaccinated. Talk to your doctor. Get your questions answered so that you can have the best possible protection. Now I want to talk about boosters. We're hearing that the federal government is starting to discuss recommending boosters to everyone over the age of 18. But for now, we're still following the CDC's recommendations for who should get it. I think at this point, most of us know that people who are older than 65, who live in nursing homes, or who are older than 50 with certain high-risk conditions should get a booster 6 months after their second dose of Pfizer or Moderna. And that everyone who got J&J should get a booster of the vaccine of their choice if it has been at least 2 months since they got their shot. But it seems like many of the people I talk to, including many very well-informed adults, are a little unclear on what we mean by high-risk conditions. In addition to conditions like cancer, diabetes, and heart disease that many of us may think of as high risk, the CDC also includes asthma, overweight, and possibly hypertension along with many other conditions on their list of who is at high risk. Please note that I said overweight, not just obesity, meaning that any adult with a BMI of 25 or more should consider getting a booster. And most adults in our city have a BMI of 25 or more. For example, for a man who is 5'10", that's 174 pounds or more. For a woman who's 5'4", it's 145 pounds or more. And anyone who works in a job in which they're routinely exposed to the public should also consider getting a booster. All of which means that most of us will need boosters. And getting those boosters now, as cases are starting to go up, will likely help prevent this uptick from turning into a larger surge. And it will prevent you from being one of the people who unintentionally passes COVID on to someone who is at high risk. So to wrap up, if you'd like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zeli to present these remarks in Spanish.
Buenos días y bienvenidos a nuestra sesión informativa semanal. En las últimas 2 semanas, Filadelfia y los condados circundantes han visto un fuerte aumento en los casos de COVID-19. Con un clima más fresco sobre nosotros y el Día de Acción de Gracias en menos de 2 semanas, esto es muy preocupante. El mayor número de casos se encuentra entre los niños de 10 y 19 años y muchos de los cuales permanecen sin vacunar. Eso es preocupante para los adolescentes, pero especialmente preocupante para los adultos mayores que pueden estar a un punto de reunirse con la familia para el Día de Acción de Gracias. Estos son los números. En las últimas 2 semanas, 4,018 filadelfianos han sido diagnosticados con COVID. Hasta ayer estamos viendo un promedio de 232 nuevos casos por día. Eso representa un aumento de 36% en las últimas 2 semanas. Y el porcentaje de pruebas que están saliendo positivas aumenta ligeramente hasta el 3%. Y ese aumento de casos que llega al comienzo del clima frío y justos están antes del Día de Acción de Gracias, podría significar que estamos al borde de otra ola. Sigue a una disminución en el uso de máscaras en la ciudad que se combina con el clima más fresco para poner a las personas no vacunadas en riesgo real. Así que, por favor, sé que todo el mundo quiere hablar de deshacerse de las máscaras, pero este no es el momento. Hemos hecho progresos reales en materia de vacunación. Actualmente, más del 91.2% de los adultos, el 84.5% de los mayores de 12 años y el 4.8% de los niños de 5 a 11 años en Filadelfia han tenido al menos una dosis. El 74% de los adultos y el 68.5% de los mayores de 12 años están completamente vacunados. Y más de 100,006 habitantes de Filadelfia han tenido una dosis de refuerzo hasta ahora. Hoy publicaremos una nueva pestaña en nuestro panel de control de vacunas con información sobre niños de 5 a 11 años que han sido vacunados. Todavía es muy temprano en este nuevo esfuerzo, por lo que los pequeños cambios tendrán un efecto descomunal. Pero ya casi 6,400 niños en Filadelfia han comenzado su serie de vacunas. La mayoría de estos niños están recibiendo sus vacunas en farmacias y continuamos trabajando para establecer nuevas clínicas con socios. Eso es alentador porque a medida que miramos hacia el Día de Acción de Gracias, particularmente dado el aumento de casos recientemente, existe un peligro real de que estemos entrando en otro aumento. Pero tenemos el control de lo que sucede después. Por supuesto que saben que voy a decirles a todos los que aún no están vacunados que esa es su mayor protección. Hay algunos grupos específicos de los que quiero hablar en un minuto que deberían considerar un esfuerzo si aún no lo han tenido. Pero para todos aquellos de ustedes que aún no se han vacunado, necesitan protección especial. Doble mascarilla si vas a espacios públicos interiores. Si decide reunirse con amigos, mantenga esas reuniones pequeñas, reúnase afuera cuando pueda y recuerde a todos que si ellos o alguien con quien están en contacto no se sienten bien, incluso con síntomas leves, deben quedarse en casa. Planifique con anticipación para usar pruebas rápidas el día de cualquier reunión, incluido el Día de Acción de Gracias. Si piense si está listo para vacunarse, hable con su médico, obtenga respuestas a sus preguntas para que pueda tener la mejor protección posible. Ahora, quiero hablar de los refuerzos. Estamos escuchando que el gobierno federal está comenzando a discutir la recomendación de refuerzos a todos los mayores de 18 años, pero ahora todavía estamos siguiendo las recomendaciones de la CDC sobre quién debe recibirlos. Creo que en este punto la mayoría de nosotros sabemos que las personas mayores de 65 años viven en hogares de ancianos o son mayores de 50 años con ciertas afecciones de alto riesgo, deben recibir un esfuerzo 6 meses después de su segunda dosis de Pfizer o Moderna. Y que todos los que recibieron Johnson & Johnson deben recibir un refuerzo de la vacuna de su elección si han pasado al menos 2 meses desde que recibieron su vacuna. ¿Qué parece? Que muchas de las personas con las que hablo, incluidos muchos adultos muy bien informados, no tienen claro que entendemos por condiciones de alto riesgo, además de afecciones como el cáncer, la diabetes y las enfermedades cardíacas que muchos de nosotros podemos pensar como de alto riesgo. La CDC también incluyen asma, sobrepeso y posiblemente hipertensión junto con otras afecciones en su lista de quién está en alto riesgo. Tenga en cuenta que se dice sobrepeso, no solo obesidad, lo que significa que cualquier adulto con un IMC de 25 o más debería considerar obtener un refuerzo. Y la mayoría de los adultos en nuestra ciudad tienen un IMC de 25 o más. Por ejemplo, un hombre que mide 5 pies con 10 pulgadas, eso es 174 libras o más. Por una mujer que mide 5 pies con 4 pulgadas, es 145 libras o más. Y cualquier persona que trabaje en un trabajo en el que esté expuesto rutinariamente al público también debe considerar obtener un refuerzo. Todo lo cual significa que la mayoría de nosotros necesitamos refuerzos. Y obtener esos refuerzos ahora, a medida que los casos comienzan a aumentar, probablemente ayudaría a evitar que este aumento se convierta en un aumento mayor. Y evitará que seas una de las personas que involuntariamente transmite COVID a alguien que está en alto riesgo. Para concluir, si desea obtener más información sobre la pandemia y las respuestas de la ciudad, puede visitar nuestro sitio de web philip.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Gracias. Thank you.
Thank you very much, Zelly. We will now move to the question and answer portion of our program. If you have a question, please use the raise your hand function and we'll take those questions in the order received. As usual, we ask that members of the press coordinate internally and keep their questions focused on the COVID-19 pandemic and the city's response to it. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we'll get you an answer. First up, we'll go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Bedigal. For Thanksgiving, I'm wondering, do you have specific recommendations for how unvaccinated people should spend Thanksgiving, and also, families with kids who are not yet vaccinated?
Yeah, I think this has been really tough for a lot of families who either have a family member who's not vaccinated, or they have young children who are not yet able to get vaccinated, or both. I think it's causing a lot of arguments and unhappiness, which obviously isn't good for anybody. In general, we want to protect people who are unvaccinated, particularly people who are older or who have underlying health conditions. So what does that look like? Maybe it looks like a Thanksgiving gathering that's smaller than usual. Using rapid tests the day before and the day of. So you're doing 2 tests, but to make sure that those are both negative before people gather for unvaccinated family members could be a good way of decreasing risk. Less so than being fully vaccinated, but it's something you can do. If you plan to do that, please plan ahead. I think if everybody shows up at testing sites trying to get tested the day before Thanksgiving, we're clearly going to have a problem. But ordering your rapid tests in advance could be helpful in that case. I don't get to predict the weather, so there's always a chance that we're going to have a beautiful day on Thanksgiving and that people could gather outside. Certainly that would be safer if you have unvaccinated family members. Other than that, doing what you can, opening windows, if that's a possibility, if it's 25, probably not, but if it's warmer, spacing people out, trying to make sure that anybody who can be vaccinated and who maybe needs a booster gets that booster as long in advance of Thanksgiving as possible. All of those things, we're just trying to lower risk here.
Okay. And for the recent uptick in cases, I know that you said it seems to be mostly among young people. I'm wondering, has there been any contact tracing, or, can you share any details on how those cases are spreading?
So, there's what we know and what we don't yet know. So there are cases among children, and there are cases actually among people in their 30s. We still see the largest number of cases that we know of from contact tracing happening in homes. People who are gathering with friends, gathering with family, and maybe catching it that way. There are certainly other settings, but that seems to be the main one, I think, because that's where people take their guard down, they take their masks off, they're maybe having a group of friends over and relaxing over a meal and accidentally spreading COVID. So, and then, with kids, a lot of the kids aren't yet vaccinated, and we're trying to get them vaccinated as quickly as possible, but it's still, there's still a lot of work to do there.
Okay, thank you.
Thank you very much, Laura. Next up, we're going to go to Lauren Winfrey from Channel 10. Lauren, you should be able to unmute now.
Hi, Doctor, I know you said this is not the time to talk about when can we stop wearing masks. So my question is twofold. So if now is not the time, do you predict a time in the near future when we will really start to have that conversation? And then also, what does continuing wearing masks mean for schools in Philadelphia and also restaurants?
Sure. So I should say we are definitely having internal conversations about when we would roll back. the mask mandate, and tying that to case counts and hospitalizations. When I'm saying it's not the time, I mean that I'm hearing from lots of people, oh, we don't need those masks anymore. And it's just not true if you look at what's happening with cases here and cases across the country and with hospitalizations. So we are not yet there. But the CDC does a nice job of kind of quantifying spread and quantifying case levels into high, substantial, moderate, and low. Right now we're in high. So high is not the time to get rid of masks. The questions we're talking about internally, is it low? Is it moderate? What do we need to look at in terms of hospitalizations? We are having those conversations. Going into the winter already with cases going up, looking at what's happening around the country, I think it's going to be a while. But I think that the hopeful piece here is the approval of vaccinations for young kids, because that can stop a lot of the spread that's happening. Now, in terms of masks in schools, I think that Dr. Haidt yesterday talked about this a little bit. We do continue to have an indoor mask mandate in the city of Philadelphia. Our schools have been terrific collaborators on that. They are having kids masks successfully in school. And that's one of the things that is letting kids stay in school. It's preventing a lot of in-school spread. And the most important thing for our kids right now is that they can be in school. So we do intend to keep masks in school. For the near future, if cases drop, once we can get the kids vaccinated, we'll be happy to take another look at that, but we're not there yet.
Okay, thank you.
Thank you very much, Lauren. Seeing as we have some time left, I'll put out a last call for questions. Please raise your hand and we'll allow you to unmute. There we go. Laura McChrystal from the Inquirer again. Go ahead, Laura.
Hi, I'm wondering, given that, more kids seem to be getting their vaccines at pharmacies rather than pediatricians' offices, Dr. Bedegal, do you have any thoughts on, why that might be? Is it any cause for concern, given that, you had talked about really relying on pediatricians who families trust to get the vaccine out?
I think for this first group of people who were really the most eager parents to get their kids vaccinated, I think people went where they could easily get appointments. And I do anticipate that as we get further into the vaccination process and we're trying to get the kids whose parents may not have rushed out to get the first appointment they can get, but who may have questions and want to really have a conversation about it, that's where the pediatricians, the family doctors will become very important. So, we've only just barely started this effort, and the pharmacies have been fantastic partners. We're really grateful to have them. They are all over the city. It's relatively easy to sign up for just a vaccine appointment, but I think this is going to take all of us.
Okay. And one more question on Thanksgiving. I'm curious if you could share how you were spending Thanksgiving this year compared to last year, and just any thoughts on kind of how it feels different than last year.
So we spend Thanksgiving with family and friends. We are doing something, it's a little unpredictable. So if Thanksgiving is a warm, lovely day, we'll be doing Thanksgiving outside all together. If Thanksgiving is not a warm, lovely day, which in the late November weather in Philadelphia, odds are with us, we're actually having Thanksgiving just at home with our family. And then on Saturday, we're gathering with a vaccinated group of people, just so we're not exposing the elderly folks to kids coming back from college, even though they're vaccinated, just in case. So we are doing possibly 2 Thanksgivings this year. But it feels good to be able to get together in person, even if it's outside wrapped in blankets.
Okay, thank you.
Thank you very much, Laura. We'll head back over to Lauren Winfrey from Channel 10.
Hi, first of all, I love your Thanksgiving plans and idea. But my other quick question is, for those who are tired of wearing masks, what is the message that you'd like to send to them?
Well, firstly, I share that. I'm a big fan of masks because they protect us, but they're annoying. They make your nose feel squished and lots of things. So I share your discomfort with them. I think we're hanging in a little longer. I think the approval of vaccines for young kids and the vaccines for teenagers that we're making really good progress on, I think that gives us real hope. Boosters, I think, will also help make sure, especially our elderly, are protected. So I'm hoping that we're not that far away, even though I'm talking about right now numbers going up. So, hang in there a little bit longer. Hopefully this is a few months and not longer. And, get your booster. I mean, I think right now we've moved from a time of shortage of vaccine and it being, you should save it for somebody who needs it more. We have plenty of vaccine. So, we aren't quite at the everybody gets a booster yet, but anybody with any indication, which is almost all of us at this point, get that booster because it makes you not only less likely to get sick, but less likely to pass this. And we want to interrupt that spread so that we can move forward out of this.
Anything else, Lauren?
Oh, just wanted to say thank you.
Thank you.
Thank you very much. Seeing as we have no more questions, I will call close to today. Thank you all very much for joining us. As a reminder, we've moved to a bi-weekly schedule and we will see you all again on December 1st unless something else happens. That will conclude today's press briefing. Thank you all very much.
And happy Thanksgiving.